of these people. All right? He was born in Canada, but his parents were both U.S. citizens. So before he turned 18, they registered him to become a U.S. citizen, and it's called acquisition of U.S. citizenship. All right? That you can, if you are born to two U.S. citizen parents, they can give you U.S. citizenship by you registering with the U.S. Embassy or Consul. All right, so hang on there for a second. So then, if that's only the people that become U.S. citizens, oh, then there's that other thing. Where's my Puerto Rican flag over there? Sometimes we forget. Puerto Ricans, they're saying so, especially now after Hurricane Maria, a lot of folks are coming. I just heard this story on National Public Radio that they're going to move to Florida and vote in Florida, and people are like, they're Puerto Ricans, how can they vote in the U.S. election? Well, guess what? They're U.S. citizens. All right? They may not have all the rights of U.S. citizens, but if you live in Guam, if you live in American Samoa, if you live in the U.S. Virgin Islands, you're all U.S. citizens. All right? We often forget the folks in those territories. Okay, so let me do a fun thing, and I'm going to come into the rest of you while your friends are standing. Okay, so in order to become a U.S. citizen, you have to take a test. All right? And there's 100 questions on the test. I'm going to ask you at random some of these questions. All right. How many amendments does the United States Constitution have? How many amendments does the U.S. Constitution have?
I guess 26.
Very close. Does somebody else want to make another guess? 27. So the people who have to take the citizenship test remember this, right? It's 27. I'm not going to ask you to name all 27, but I am going to ask you, there are 4 amendments that relate to the right to vote. 4 of the 27 amendments relate to the right to vote. Tell me what one of those amendments are.
19th.
And what did the 19th Amendment do?
Women's voting.
Excellent. She wins. All right. So the 15th Amendment gave the right to vote regardless of your race. That was part of the Civil War. The 19th Amendment gave women the right to vote. The 24th Amendment, back in the 1970s, said you can't require people to pay a tax. It was called a poll tax in order to vote. And that was 40 years after, however many years after the Civil Rights Act, the Voting Rights Act, we were still restricting the rights of African Americans to vote. And so we needed a constitutional amendment to overturn those laws, primarily in the South. And then most recently, that's most relevant to many of you, is it was the 26th Amendment that gave 18-year-olds the right to vote. All right? Which is going to be very, very important in this election. Okay, let me come over here and ask another question. So, tell us what the economic system in the United States is called.
The economic system, capitalism?
Yay! So the 2 correct answers are it's a market economy or it's a capitalist economy. All right? So a little bit of propaganda maybe there, depending on how you might feel about that. So let me ask one more question, which is, let me come all the way down here. And this is a giveaway, so we'll ask the dean. The Federalist Papers were an important document that described the rights of the federal government versus the state government. Name 2 of the authors of the Federalist Papers. One is going to be easy.
Thomas Jefferson.
No. Anyone else? Yes?
John Jay and Alexander Hamilton.
John Jay and Alexander Hamilton. Very good. So who's the third?
Madison.
James Madison. So if you go see Hamilton, you're going to learn about the Federalist Papers, all right? Okay, so let me go to that side of the room. And now we're back to the 7% of folks who are trying to get in line to join the rest of them and become U.S. citizens. So know the way we're now very conscious of the fact that words matter. The way that you apply to become a citizenship is you apply to become naturalized. All right, now think about that. If you're not a U.S. citizen under U.S. immigration law, you're unnatural. So the only way that you become natural is to become a U.S. citizen. All right? And then we call people who aren't U.S. citizens aliens. They're not from outer space, but that's the technical word that's used in the law, is that you are an alien. All right? So again, words matter, and if we keep telling people these things, that they're unnatural and they're aliens, then obviously some people may tend to believe that. This is actually now the repeat of earlier, which is that you can get a green card, and I'm going to come to how to get a green card, and then you have to wait, and after you get a green card, you have to apply for naturalization and get U.S. citizenship. Or another way, as I said, was the Canada way, was if you're born outside the United States and you can get citizenship through acquisition. Okay, so how do you get a green card? That's the intermediate step. Sometimes it's called lawful permanent residence, or LPR status, or permanent residence status. So there's about 5 ways that you get a green card. What's the first one? Now people's other answers are relevant. Yes?
You could be the child of a professional or skilled worker that gets a green card. Or you could be a skilled worker from another country.
Okay, so yes. So you can get a green card through employment, basically. All right, that's one way. What's number 2? Through asylum or refugee status, yes, as another status, and then you step into the green card number 2. What's number 3? Marriage or any other kind of family relationship, which I'm going to talk about. So number 3, the primary way is family relationships. What's number 4? Somebody said it. The lottery. There is actually a green card lottery in which you get 50,000 people get green cards from around the world. And we'll talk about that in a minute. And then the 5th way, I'm going to leave as all the other ways. There's lots and lots of other little technical things. So let's talk about family. So if these folks will step back. If I am a family member and I'm married to a U.S. citizen, I get a green card right away. All right? There's no waiting, there's no mess, there's no fuss. If I have a permanent residence green card status and I get married, it's a 2-year waiting period. Okay? So we have to be separated. We are legally married. We have to be separated for 2 years because she can't come in for 2 years. All right? So when we talk about get back in line or get in the line, are we going to stay separated for 2 years? Some of us will, and some of us won't. Some of us will find ways to get back together, and she may end up becoming one of those undocumented people. All right? Because we're separated for 2 years, and that also applies to a child. All right? The good thing is, after marriage equality, this also applies. So if I got married to a man, it's the same thing as long as the marriage is legally recognized. All right? What about, there you go, step forward. What about, I have an older daughter who's 18 years old or older. How long do you think the wait is?
20.
Okay, so for most people, the wait is 12 years to reunite with my daughter or my son. Okay? 12 years. So let's step back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so here's where the line is. All right, I'm waiting in line for 12 years. Where's my person from the Philippines? Over here. Come around here, because you're gonna have a long wait. Okay, actually I made a mistake. So the wait for most people is only 7 years. The wait for the Filipinos is 12 years. So you get to be here, all right? So 7 years, 12 years. And then where's my person from Mexico? So you come all the way back. Your wait is 21 years. So 1, 2, 3, 4, 5, 6, 7, 8, 9 more years. You're all the way over here. Okay? So these are the waiting times if I'm trying to bring my adult son or daughter in. And then if you're from the Philippines,
25.
the wait is 20 years, so go to where Mexico is. And Mexicans, the wait is 23 years, so back up 2 more. All right? So again, when people say you should just wait in line for your turn, this is how long the line is. All right? That it's not a straight line. The lines are different depending on what country you're from, and that's back to 1965 when we changed our immigration law and finally let people in the same way from every country, but we've set a cap of 20,000 per country, and that's why the lines are so long. It's because those countries historically hadn't been able to come in. For the Asian countries, it was because of the 1882 Exclusion Act that said if you're from Asia, you can come in, and it wasn't until the 1950s and 60s that Asians could come in. Mexico is even more complicated because Mexico was part of the United States, but Mexicans couldn't get green cards, even though they formally were part of the United States, and they had to wait in line as well. Yes?
I have a trivia.
Yes?
So in the Treaty of Paris,
Yes?
Philippines, Puerto Rico, and Guam was a U.S. territory.
Yes.
But the Philippines wanted their independence. So we were once a U.S. territory, and then we didn't. We voted against it, so we got our independence.
So again, long history, every country has these unique immigration status issues. So another issue with the Filipinos was during World War II, remember I said when we become a U.S. citizen was through military service. So we promised all the Filipinos who were fighting on the Allied side during World War II, if you join the U.S. Army and the Allied efforts, we'll make you citizens. And then we changed our mind. And we said, never mind, we won't do that. And so again, it's been a long fight. Number one, to get them their U.S. citizenship status, and number two, to get them their veterans benefits. In this category, most of the time you can come in, the only backlogs are India and China. All right? But most of the time, people can come in pretty quickly for employment. If you're a refugee, where are the refugees coming from, mainly?
Cuba.
Cuba? Somewhere you said Vietnam? So the top 10 countries in 2016 were the Democratic Republic of Congo, number 1. Syria was number 2. Burma was number 3. Iraq was number 4. And Somalia was number 5. Okay? So kind of a mix, not clear rhyme or reason. Lots of complications. We can have a whole discussion about refugee policy and how it's tied to foreign policy. Historically, we have not necessarily taken refugees from the places that it makes the most logic from. And one of the things that the current administration is doing is cutting down on the number of refugees to its lowest number since World War II. So then let me do one final thing. So the diversity lottery, the lottery for around the world, guess who's the top country? Egypt. So again, kind of random, but it does allow countries that historically have not had high immigration into the United States, particularly from Africa, to come into the United States, all right, as a way to diversify. That's really the point of the lottery. All right, I'm going to stop there. Thank you to all my volunteers. You can keep the flags in there. Church. movement to protect Central American refugees coming to the United States, involved in litigation involving Central Americans, Mexicans. I was involved in litigation around stopping Haitians coming to the United States that went all the way to the US Supreme Court. How many of you have heard of Proposition 187? We're about to vote. So can someone say what 187 was?
Well, I know it affected education, but it was really focused on English only movement.
So it was in 1992, it was a state ballot initiative that said if you're undocumented, you can't go to public school, you can't get health care, you can't get any social services from the state. And the people of California voted for it, all right? And so, that was unfortunate. The fortunate thing is then my attorney side here when we were part of the litigation that blocked it and said that it was not constitutional for the state to do that. I personally, though, got really burned out. That's me speaking at a rally. And so I did a career change and I stopped doing law, even though there was some bridging there where I started focusing on HIV and AIDS as a career, and worked a long time on really supporting Asian and Pacific Islander communities and other communities of color to combat HIV and AIDS. And I did that, and that work led to work on broader health issues and then on broader community issues. And I was privileged to help write an executive order started by President Clinton in 1999 that created the first federal initiative that focused on Asian Americans and Pacific Islanders. There had been previous efforts that focused on other communities of color, but there had never been one that focused on Asians and Pacific Islanders. And so President Obama re-upped that initiative. President Bush also continued it sort of under the radar. And I was privileged to help write the reports from both the Clinton initiative as well as the Obama initiative. And then I did a final career turn and stopped doing that work, focused on the Asian American and Pacific Islander community, and worked for 7 years at a foundation called the California Endowment, which many of you may have heard of, one of the large health foundations here in California. And I really focused on what happens to people when they get health care. Not just health insurance, but what happens when they come to you as future physician assistants, when they come to you as future nurses, when they go to doctors, what kind of healthcare system are they interacting with? And is that system able to really address the needs of the diversity of immigrants and the diversity of people of different ages, of different backgrounds, who speak different languages, and really focus on helping make this health systems here in California more responsive to that diversity. And then finally, since I left the endowment, I've continued to do that work, focusing on issues like healthcare reform, like health information technology, how we can use technology to help address those issues, and how now we no longer talk about disparity so much as the issue of health equity. How can we achieve health equity by changing those systems to be more responsive? I've been able to, since that time, work in places like Connecticut and Oregon, in addition to California. And then this was the exercise. So what I want to leave you with the final couple of minutes is that as we talk about health equity, we often now talk about social determinants of health. How many people have heard of social determinants of health? But we often don't think about immigration status as a social determinant of health. Historically, what we've done is we've said immigrants as people, as an identity, have these barriers, have these challenges. But we've never done that structural analysis to say the barriers are not about them as people, the barriers are about their status, all right? And just as you visually saw how complicated that status is, how long those waiting times are, how difficult it might be for people to stay separated from their families, and that's why they oftentimes become undocumented. That's why they're stressed out, because they're waiting in that line and they don't know when they're going to reunite with their families, so that causes lots of mental health issues and stress. But I also take this back in a global way when we think about these issues. And it, just as in the work that we do around health equity now, we often use the line that your health is determined more by where you live and where you go to school and where you work and where you play and where you worship than what kind of healthcare you have. How many people have heard that? It's more determined by your zip code, right? But if you apply this to immigrants, think about where immigrants began their journey in their home countries. In their home countries, they were often targeted from the moment that they were born. If they lived in a place in which there was ethnic conflict, in parts of Africa, in Bosnia and Herzegovina, where it might be religion. If you were in Ireland, I just came back from a visit and learned about that history of the conflict between Catholics and Protestants. So again, you may be born into a situation in your home country in which you're already being targeted. Certainly if you're a woman, if you're a young girl, the odds are stacked against you in most places around the world, and in the United States as well, that you don't have access to education, the expectation is that you're going to marry, and you don't have that kind of opportunity for a future. So what opportunities are available to you? Did you inherit wealth so that you're living in the hills of El Salvador? Or are you living in the barrio? Are you living, again, in a really nice place in Brazil? Or are you living in one of the favelas? All right, so where you were born, how you were born, who you were born to is already making a difference of what kind of health you're going to have and what your journey is going to be. And then in those places, there's poverty, there's violence. All the people that are now coming in the so-called caravan from Honduras primarily are fleeing poverty and violence. And there's so much pervasive violence that they feel like they literally have to walk thousands of miles to get away from it. All right? So again, it starts from where they were born. It goes to what propels them to leave their countries. Sometimes people leave because of war, because of natural disasters. The journey is usually hazardous across land, across oceans. So in Southeast Asia, when refugees came from the Vietnam War, they had to cross oceans and often drowned or were attacked and raped and killed by pirates who were trying to traffic them across those oceans. And then the lucky ones come by air. Right? But most people who are fleeing only have the choice of using foot or sea. So that's how immigration status happens in the United States. But again, thinking structurally, how did that person get to where they are to now land in Northern California, or to now land in Texas, or now land in Arkansas? And then once they're here, their access to housing, to education, to employment, to healthcare, to social services, to legal services, are also dependent on their immigration status. So again, it's not them as immigrants, their identity as immigrants, whether they're from Honduras, or whether they're from Vietnam, or whether they're from Syria, or whether they're from the UK. But it's, again, that combination of their journey, their status now, and then our laws that often create barriers to access because of their status. And then obviously because they don't have access to good housing and education and employment, then we know from social determinants of health that they're also less likely to have access to good food, to physical opportunities for physical activity, for safety, because they may have to live in a place that's violent, let alone those other factors that we rarely talk about, which is their own self-esteem, a sense of cultural pride, a sense of well-being, a sense of celebration of who they are and who their total selves are. And so think about this when you think about social determinants, that again, it's not immigration status, it's not immigrants and who they are, but it's the status that is the structural issue. So how do we fix that? Well, we're actually going to the opposite. So under this president, who started his entire political career in some ways, questioning the citizenship status of then candidate Barack Obama and eventually President Barack Obama. So again, questioning that very first visual that I showed for you, that Barack Obama was born in the United States and there was no question he was a US citizen. But for years and years, Donald Trump put out the lie that Barack Obama was not a US citizen, all right? And so then it's no surprise that his campaign rhetoric then turns to Mexicans, calling them vile things, talking about building a wall, targeting Muslims, and having to go 3 times to court to try to put in a ban from certain Muslim countries that ultimately, unfortunately, the US Supreme Court upheld. I mentioned refugee admissions. With the refugee crisis around the world, there's like 35 million refugees around the world. We are going to take in 30,000 next year, which is the lowest number that we've ever taken in, all right? And so again, we're doing everything we can to build virtual walls, even if we don't construct the physical wall on the southern border. Aggressive enforcement that we don't hear a lot about, increases in detention, especially private detention, the end of DACA, or Deferred Action for Childhood Arrivals. So over 800,000 young people who got this temporary status under President Obama's administration had that taken away, and then again, the courts restored it. Temporary protected statuses for people fleeing Central America, Africa, the Caribbean, again, also taken away. Added to the rhetoric of a reference to the kinds of countries that we want people from, and he said, why can't we bring more people from Norway? All right? And then when the Senate and the House were trying to come up with a deal to provide legal status to the DACA young people, the bargain that President Trump wanted was, let's cut all those people in line, all right? Let's cut off family immigration in return for giving legal status to the DACA individuals. And then the family separation policy is not just a legal policy, but it's also based on the fact that we're now criminally prosecuting people for violating immigration law, and that becomes a real complicated thing as well. And then the latest thing with this ban that closes the southern border. So let me end finally with, how many people have heard of the public charge issue? I hope you all figure this out after I talk for the next 5 minutes. Okay, so one of the requirements for getting a green card, after you're waiting in line, you have to, you don't have to take that citizenship test and answer those hard questions. You do have to take an English test. You have to pass a criminal background check. You have to pay lots of fees. And then you have to answer questions if you're not a communist, you're not a terrorist, a lot of other things. But one of the things back from the 1800s again is you're not likely to be a public charge. And historically, that came from the same time as the Chinese Exclusion Act. And actually, the wording about public charge came in trying to keep Irish immigrants out who were coming in because of the potato hit. All right, so on the West Coast, we were trying to keep the Chinese out. On the East Coast, we were trying to keep the Irish out. So they were racially based. Because again, we were largely Protestant and we didn't want those Catholics, those poor Catholics coming in. And historically what that has meant, and this is really complicated, I don't expect you to follow this, it kind of makes sense that if you're on cash assistance, if you're on welfare, then you shouldn't get a green card, all right? Because you can't support yourself. It's kind of a little common sense. If you're relying on the US government to pay for your income, or you're in long-term care and you have no prospect of leaving, then questions should be raised, and then there was always ways to get around it. A sponsor or a family member could say, I'm going to support this person in the future, they're not going to depend on welfare, we're going to look at the other circumstances. What President Trump is proposing, less than 3 weeks ago, is let's not just focus on cash, but let's say you're under 18. You're a public charge, automatically. You're over 62. You're going to be a public charge, and we're going to deny a green card. You don't have a college education. You're going to be a public charge because you might not be able to support yourself as well. If you don't speak English very well, you're going to be a public charge. If you have any medical condition, back to pre-existing conditions, we're having lots of conversations about the Affordable Care Act and pre-existing conditions. If you have any medical condition and you don't have private insurance for life, forever and ever, you're going to be a public charge. If you have household income under 125% of poverty, you're a public charge. If you have a poor credit score, and on and on and on, all right? So then to counter that, the only way really is, of course, if you're working, you have a graduate degree, if you're proficient in English. Really, the only way in green is if you're over 250% of poverty, all right? And so what this really is saying, it's a backdoor that is not changing the immigration law. It's using this obscure technical thing that wasn't really used, called public charge, to really change the nature of who gets to come in. Right? So obviously, there's some exceptions to this that I won't go into. And then obviously what this will do, it will scare immigrants who, again, are waiting in line, who don't understand all these complications, that they won't get health care, they won't get housing assistance, they won't get SNAP or food assistance. And then that obviously harms the economy, it harms the healthcare sector, because there's less people that are insured, there's more people that are uninsured. When there's more people that are uninsured, they go to the emergency room because they delay care. When people go to the emergency room, then all our costs go up because the cost of healthcare go up, all right? So lots of reasons to oppose this. We have until December 10th to weigh in as citizens or residents of this country. You don't have to be a voter. You don't have to be a U.S. citizen. You can send in comments. And I would really encourage you to go to this website, protectingimmigrantfamilies.org. And there's lots of resources and lots of information. And it also tells you how you can actually submit a comment to say, hopefully, that you agree with this as well. All right? And I think that's it.